My name is Jason Mantzoukas, and I'm thrilled to be back talking with Dr. Kiame Mahaniah, practicing physician and CEO of the Lynn Community Health Center in Lynn, Massachusetts. In 2022, we are celebrating our 50+1 year anniversary, and this is part of a series of videos to celebrate the significance and impact of this organization. This is the third in our series of videos. If you missed the earlier videos, what are you doing? Go back, watch the initial videos. It'll explain why that guy from Brooklyn Nine-Nine is here talking to you about the Lynn Community Health Center. I'm Jason Mantzoukas. My father was Bill Mantzoukas, who was one of the founders of the Lynn Community Health Center in 1971 and served as its first executive director. So I'm here to talk to Dr. Kiame Mahaniah. Kiame, how are you?
I'm doing well, Jason. You should know that I got lots of inquisitive emails like, who are you and why do you know Jason? But I'm very happy to talk about even more aspects of the health center today with you.
Oh, I'm thrilled. It's very exciting. You know, normally when I get on to talk to people about things, it's about a lot of really dumb jokes and weird characters that I've played on TV. So it's really wonderful to be having a conversation that is about putting good things into the world and helping people. And I'm excited for this conversation.
Great.
Kiame, what I'd love to start talking about is school-based health centers. Currently, you have school-based health centers in 18 schools in Lynn. If you could, tell us a little bit about what are school-based health centers? How is it different from, say, the school nurse that was in high school when I was there?
Yeah, so school-based health centers at Lynn are one of the prides. We're really super proud of the fact that we have these school-based. And what it is that we have our own employees, so medical professionals, that are in the schools. They're available for any of the students that are in the school that would want to talk about any problem. We have nurse practitioners who are there, so they're able to address the full spectrum of problems. The usual problems that you would expect, someone falls in the playground or, some sort of acute event happens or they have a cold or a rash. But we also are able to provide chronic disease management, particularly around asthma. And as you well know, your father started us as a mental health clinic. So it's unsurprising that our school-based health centers also include a therapist, so kids can go and return therapy. But also we provide psychopharmacologic services. So if the child has ADHD and they need medication to help with that, we actually can provide it, we can monitor it. And the great advantage is that it happens in the school. The parent doesn't have to take time off. The kid doesn't have to leave school. They can come for their 15, 20, 25-minute visit. And it's right then and there.
That's great. That's, as a kid who grew up with asthma, going to the nurse for an inhaler or something like that was a semi-frequent occurrence. So I understand that completely. How do people enroll their child or student in these programs if their school has it,
I think overall in Lynn there are 23 schools and we're present in 18 of them. So we're in all the elementary schools and all the high schools, and we're building up to eventually be in all the middle schools as well. Essentially, if you are a student in the school, you qualify for care there. You have to sign a consent. But we collaborate with the school, so that goes out with a number of the paperwork that parents have to fill for their kids. And so they just sign, yes, I agree to have my child be seen at the health center. And obviously we close the loop of communicating with the parents as well, so there's no surprises. But essentially anybody that goes to that school qualifies to be a patient of ours.
Some of you might be wondering, what does a school-based health center look like? Well, let's take a look.
Who else would I be waiting for this?
It is like a small doctor's office in the school.
We get to see the kids in their natural habitat, which is great. And because I'm part of the school, I'm part of the building, and they see me walking through the lunchroom sometimes, I go to their classrooms, they learn to trust me a little bit more. So they may come in for their sick visits at first, and then it progresses to just dropping in to show me their report card or show me their prom dresses, and just talk about things that are going on in their life, and they feel much more comfortable asking questions, which is really the purpose of school-based health, is that we can be there as an opportunity opportunity for them to really access healthcare in a way that would not normally be available to them.
Parents love the idea because then you don't have to get your kid at school, dismiss the kid, and take them to a doctor's appointment.
Being part of the school-based health center allows for us to have better access and support to the community and being able to decrease the burdens that a lot of our hardworking families experience. Integrated healthcare is the joining together of mental health and also medical care, and understanding that both of those things, when put together, are the best ways for outcomes to be realized for the patients that we serve. To be able to provide families with the peace of mind that their children are going to be seen for behavioral health and mental health services while they're in school, I think really allows families to be better prepared and more willing to engage in those services.
A lot of the times, if I'm seeing a kid for a physical or a sick visit and I realize that they need behavioral health services and qualify for it, I'll give a call out to their guardian, say, hey, is this something that you'd be interested in? Guardians usually say yes.
Anymore, so you need a refresher. Anybody have any?
So a typical day in a school-based health center, we come in the morning when the school starts, and the kids are allowed to make appointments before school, after school, and during lunch. So there's a typical rush in the morning to be like, oh, yep, I need to see Miss Julie. It's about a confidential visit, or my stomach hurts, or I have a headache, or I need a sports physical now. And the front office staff, our office coordinator, will make the appointments and take the kids out of non-academic classes.
We get kids since 7:30 in the morning for different needs. We're a very welcoming place, and most of the kids that we serve are immigrants and newcomers.
As a bilingual therapist, I speak English and Spanish, which allows for me to serve children and provide therapy to children who not only speak English but also Spanish. And there's a lot of stigma that continues to be present for these families, and to be a provider who can help them feel a little bit more comfortable and secure in that relationship, and knowing that there's a transparent communication and ongoing communication can really help their child benefit further from therapy.
Healthcare is often thought about as something that you have to go do once a year. You have to go get your physical. Okay, I'm sick, I have to go to urgent care today, And to teach kids that healthcare is so much more than that is really rewarding.
Being part of a school-based health center really increases the access to much needed care that families do very much want for their children.
Come to school and we will get your needs met.
So, Kiame, schools were shut down during the height of the COVID pandemic. Were you able to keep this program up and running? And if so, how?
Well, that's a great question. School-based centers are really all about flexibility. So in a natural course of events, normally kids can either schedule appointments with our nurse practitioners and therapists and psychopharmacologists, or they can walk in if there's an issue. And so what happened during COVID is that since the schools were physically closed, that physical proximity was no longer possible. And so we shifted to telemedicine. So all of our services were available through telemedicine within 3 days of the schools shutting down. So there's no big lapse there. And so some of our staff essentially moved to be able to answer all the calls and be able to address kids' issues. Some of our staff actually participated in all the other things that the schools needed to do, meaning they needed to bring food to certain families, they needed equipment to certain families, they needed support in different ways. And so we were involved in very many different ways. And actually one of the things that was remarkable is that many of our school-based staff shifted to whatever time that they weren't using to take care of the kids, they shifted it into our COVID testing and immunization side of things.
The pandemic must have provided an explosion of people in need of mental health services specifically, and are you seeing an increase in those services, and how are you addressing them?
Yes, we've seen a very significant increase for all of our services throughout the health center, but particularly for youth-oriented services. We're trying to increase the access, and we're trying to target to see who are the people that need short-term help, who are the people that need long-term help, and how can we accommodate all those things. But it's good in the sense that we're there, we're available, and we're able to provide that help.
Oh, yeah, that's exceptional. The fact that in those schools, those kids that need those services have access to them in a way that is easy and effortless to engage with. That's wonderful.
Yes. And I would say that, one of the also amazing fact is that this is a collaboration with the schools, right? We're guests in the schools. I mean, we're longtime guests, but also because of interaction with the schools, we've really been able to further collaboration with other youth-based services. We really see ourselves fitting into a general network of youth-based services that's really trying to make sure that the kids in Lynn are all getting the amazing kind of support that they deserve.
That's great. That's amazing. We've talked a bit about the school-based services, but I know there are other youth-based services that you work with. And could you tell me a little bit about that?
Yes. So we are present in the schools, and obviously we and the schools are providing services to sort of the 5 to 18, 19-year-old range, so that youth age. But there are many other organizations within Lynn, like Raw Arts, like the YMCA, that also provide services. So one of our aims by being in the schools is that we're able to really be advocate for the kids. We're able to connect them with all these different services. We're able to remove barriers but by which that students might experience in trying to access some of these other organizations. And one of the things that we just launched that we're particularly interested in seeing how it's going to impact the city is we have an adverse childhood event response team. We're collaborating with the police and the schools. And so when the police gets called to any home, if they happen to notice something that may worry them about having kids in that environment, they contact us, and the team goes and offers their help to the family. And the goal is simply to connect that family with whichever service it happens to be that they might want, whether it's help with their heating bill, whether it's therapy, whether it's medical care. And so by belonging into this consortium of care, we're able to really link these children and their families with whatever service it is that they might need that is offered in the city of Lynn.
So these school-based health centers, they're in schools. Is it the kind of thing where any kid who's not feeling well or who is in need in some way can just walk down the hall and walk into the health center that's there in their individual school?
What the school-based health center does is that it allows a student to access all the full range of our services with essentially no barrier. They don't need to go anywhere. They don't need to know how to get to our health center, our main health center. Their parents don't need to take time off. They don't need to miss any school, right? It's right there, very convenient. And it's really part and parcel of our mission, which is how do you provide excellent care to everybody in the community, regardless of ability to pay, regardless of language ability, regardless of immigration status. And so having it in the schools really makes it super convenient for our kids.
Kiame, this has been an absolute delight to chat with you again, to learn about the school-based health center programs at the Lynn Community Health Center. Thank you for making the time. This has been wonderful. If anyone is watching in the audience right now and would like to learn more about the Lynn Community Health Center, about how to support it, what it does, please visit the website, which you can see on screen here, but it is lchcnet.org/donate to learn more and help support this wonderful organization. Thank you, Kiame, for taking the time.
Thank you, Jason.